Myself, Syed Aisha from RJ College, TYBSc Zoology Department. Hello, friends. I'll be telling about gangrene, its different types and causes. So, let's get started. Gangrene is a condition that occurs when body tissues dies due to loss of blood supply. For example, it can happen in fingers, toes, and limbs, and they are most often affected. But gangrene can also occur inside the body. It can also damage organs and muscles. It occurs in conditions like diabetes, atherosclerosis, smoking, trauma, or serious injury can cause gangrene. Basically, the gangrene is mostly seen in three types. First is dry gangrene. Dry gangrene occurs when the blood supply is slowly reduced to an area. Dry gangrene is usually characterized by cold, painless, shivered, and dry. The affected tissues are often said to look mummified. Dry gangrene is usually seen in patients who are suffering from diabetes, that is, diabetes mellitus and diabetes insipidus. The blood vessels are damaged, which causes a reduction of blood flow to certain areas of the body, such as the fingers, toes, and the tip of nose. In patients with high cholesterol, is a risk of deposition of cholesterol and lipids called plaques within the blood vessels in the peripheries like toes and fingers, which leads to decrease in the blood vessel diameters by narrowing the lumen. This may lead to formation of gangrene. The second type of gangrene is moist or wet gangrene. Wet gangrene occurs when infection and bacteria invade deeper tissues. The invading bacteria release toxins, leading to blockage of the blood supply. There is a sudden reduction in blood to the affected tissues. There is a formation of black blisters and foul-smelling pus beneath the thinned skin and the area. This causes excessive swelling in the affected area. WBC cannot reach that area. As infection is associated with release of discharge and pus, it is known as wet. Moist and wet gangrene is very painful. Wet gangrene can spread much quicker than dry gangrene, and it may also lead to life-threatening complications like septic shock if not treated immediately. The wet gangrene is generally caused by bacteria, injuries, foot ulcer, or burns. The last type of gangrene is gas gangrene. Gas gangrene occurs when a specific bacteria, that is Clostridium, invades an area where the blood supply has been reduced. Gas gangrene was a common cause of death of soldiers in the wars. It increases vascular permeability and produces necrotizing activity. Gas gangrene usually occurs deep in the tissues and gets its name because the bacteria produces gas. A gas composition of 5.9% of hydrogen, 3.4% of carbon dioxide, 74.5% of nitrogen, and 16.1% of oxygen was reported in one clinical case. These were the three types of gangrene. Thank you.